Good day to each and everyone. So our topic for today is on reticulocyte enumeration, anemias, classification of anemias, some of the pathophysiologic mechanism of anemias, and also the clinical signs of animals with anemias. Usually the bone marrow will produce these reticulocytes in order to compensate the needed or the factor that needs in the body. So this is an important measurement to know what indications. So the reticulocyte count is an expression of the percentage of red blood cell in the blood which are reticulocytes. So they are usually reticulocytes are non-nucleated immature erythrocyte with stainable cytoplasmic RNA. So as what you've seen in the lower right picture at the bottom, you can see a figure of circle, and there is a stainable RNA cytoplasmic in the RNA. So that is a sample of a reticulocyte. So reticulocytes are best observed by staining for such stain like new methylene blue stain, and then you let it air dried, and then you will see the polychromatophilic staining mass or the basophilic um, tinctural properties. So species characteristic of reticulocytes. The dog has a smaller numbers of reticulocytes in healthy dogs, which comprises of 1%, and you will see a large amount or numerous amount of reticulocytes when the dogs is in state of regenerative anemia. And usually the dog reticulocyte count was reported to mimic the bovine pattern. So in cat, when compared to different domestic animals, they are such a unique. So they have a two components of reticulocytes as what we see in the picture in the right portion. So you can see the punctate type and also the aggregate type. So punctate is more on like a circle pinpoint on the morphology of the red blood cells, whereas in the aggregate you can see an aggregations of reticulocyte or staining in the um, RBC. So in aggregate type is similar to those in other species and accounts for 0.4% of the RBC in healthy cats. And there is a higher values of this may indicate that the cat has a current erythropoietic activity. So the aggregate cells usually they are these cells are cells with large aggregates of reticulum, whereas the punctate, as you see in the picture in the right, usually occur in large numbers in healthy cat and usually increase when there is a responding anemia or if there is an anemia. So usually the punctate are cells that having a 2 to 6 small granules of reticulum or a small pinpoint of reticulum. In cattle and horses, they're somewhat unique when compared to other domestic animals because their reticulocytes they have no circulating polychromatophilic erythrocytes, and their maturation is more complete in the bone marrow. As we all know that cattle and horse have a longer lifespan of red blood cells, so that would explain. And then in cattle, reticulocytes are absent in healthy cattle but are increased when there is a problem or there is a pathologic state of anemias. In horses, the reticulocytes are absent in the blood of horses in both health and disease. No, if there is a healthy horse and a diseased horse, you cannot find a reticulocyte. But however, there are some instances or some hematology analyzers can detect low concentration of reticulocytes in horses. So in interpretation of reticulocyte percentage, the lower the PCV, the higher the reticulocyte percentage should be in responding anemias. So when there is a low PCV, and then usually there is a low PCV, there is in anemic state, and you can see a higher reticulocyte count, meaning the body or the bone marrow able to produce the red blood cell due to anemic state. Higher also percentage are observed in hemolytic than in hemorrhagic types of responding anemia. It could be, in hemolytic, there is an easy detection of the body when compared to in hemorrhagic state. So when comparing a regenerative anemia and a non-regenerative anemia, um, you can always see it, in the blood smear. If you want to differentiate between the two, the regenerative and non-regenerative, you will see in non-regenerative, you cannot see any reticulocytes or there is no reticulocytosis. But when a regenerative, you can see a numerous or multiple number of reticulocytes or there is a reticulocytosis. So this is a most important means or in differentiating or identifying whether the animal is in non-regenerative anemia or in the animal is in regenerative anemia. In order for you to have an understanding of the disease, and also to come up with a good treatment of the animal. So the other means of examination is by bone marrow examination. So this bone marrow examination is an important means now for you also to differentiate whether there is a problem with the animal or there is a normal state of the animals. So usually in health or healthy animals, you can see a 90% of the erythroid cells and should be rubicytes and metarubicytes. So you can perform it via iliac crest, trochanteric fossa, and also sternum or rib, employing special bone marrow with a gauge of 18 gauge cerebrospinal needle. So actually in the practice, having this a bone marrow examination is very somewhat difficult. So I didn't experience this procedure because somewhat difficult and you can injure the animals, or you can hit the nerve. But in the US, there are specialized um, peer person, to perform this. So usually in bone marrow examination, when there is a high percentage of immature stages, this will indicate a hyperplasia, or there is a normal increased number of cells, and also would indicate neoplasia, or there is a tumor-like or something, a tumor characteristic of the cells, or there is an abnormality. So this is also important measures if you want to know whether there is a tumor or there's a hyperplastic going place, there is a plastic anemia. So bone marrow examination is very important. So the next topic is erythrocyte anemia. So usually in the practice, uh, most client bring their dog to the clinic and have a disease, and you will encounter many times that the animals in is in anemic states. So we will tackle here in this topic. So anemia is defined as a reduction in the number of red blood cell, hemoglobin, or both in the circulating blood, or also defined as an absolute decrease in number of the hematocrit or PCB, or decrease in number of hemoglobin concentration, and decrease in number of RBC count. No, so if there is a decreased number RBC count, there is a lesser chances of the oxygen to distribute it to the tissues. If there is a problem with hemoglobin or lower hemoglobin, there is also a decreased chances to distribute oxygen to the tissues. So usually in anemia per se is not a diagnosis. So the cause of anemia should be identified. No, there are so many problems or many conditions or disease. No, having a manifestation of anemia, like chronic kidney disease. There's an anemic state, like other like ehrlichiosis. You can also encounter anemia. So if there is an anemia, you should identify or diagnose what is the disease that causes this anemia. No, so usually when the owner asks you, so what's the disease with my dog, and you say the disease of your dog is anemic. So usually the owner will have a confusion. Um, what is anemic? So there's also anemic with a nutritional deficiency. There's also anemic um, with the dog is having no manifestation. So usually as a doctor, you have to diagnose really what is really the cause of this problem. So classification of anemia is according to three important factors. So the size, no? So we already know that in order for you to determine the size of the red blood cell, you will see it in the CBC machine, and you can see an indication or MCV units there. So if there is a higher MCV, you can see a macrocytic condition. When there is normal MCV, there is a normocytic or normal size of the red blood cells. When there is a low MCV, you can see a microcytic, meaning the red blood cells is small. Red blood cell is small. So in hemoglobin concentration, you can detect it by MCHC. No, you can also detect it. You can see it in the machine. And if there is normochromic, meaning the stain of the red blood cell, no, is normal. Or if there is hypochromic, as what I have showed last week, there is a increased white, no, in the central pallor, no, and also a hyperchromic state. No, when there is a hypochromic, you can see a lower MCHC value, and also in hyperchromic, you you can have a higher MCHC value. And also bone marrow response. No, so there are two important means in identifying it, no, by regenerative and non-regenerative. No, and one of the most important um, means is to know to differentiate this is by the presence of reticulocytes. So in differentiating regenerative and non-regenerative, if you were able to differentiate it, you will have an idea or clue, no, what could be the possible. or what are could be the branches of diseases involving with the patient. In regenerative anemia, meaning there is an indication that the bone marrow is regenerating, or there is a regeneration, there is a regenerating replacement population of erythrocytes. When it is a non-regenerative state, it indicates that the bone marrow is not regenerating a replacement population of erythrocytes. So one of the clues in regenerative, you can see a state of hemolysis, hemorrhage, and also regeneration after the cause of non-regenerative anemia has been resolved. In non-regenerative, you can have a clue of anemia of inflammatory disease. You can also have a renal failure with acute kidney failure or chronic kidney failure, and then also in iron deficiency anemia, aplastic anemia, pure red cell aplasia, and also endocrine disorders. So the major pathophysiologic mechanism of anemia are blood loss, accelerated erythrocyte destruction, reduced or defective erythropoiesis. So when there is blood loss, it could have a hemorrhagic state, no, or hemorrhagic anemia. It could have the blood goes out into the vessel and goes into the interstitial tissues, no. So there is a blood loss happening. And then second is accelerated erythrocyte destruction, meaning it could have a decreased erythrocytic lifespan, either by intra or extravascular hemolysis. It could have a hemolysis happening, no, in the blood vessel, or it could have the immune-mediated destruction of the body, or the immune system, no, destroy the RBC. And the third is reduced or defective erythropoiesis, meaning there is a reduced production of the bone marrow to produce these erythropoiesis or red blood cells, or there is a problem with the bone marrow that enable of the bone marrow to produce these red blood cells. No, for example, if you have a chronic kidney problem, and then the kidney cannot excrete anymore erythropoietin, and this erythropoietin is an important component to produce or in erythropoiesis. No, if there is no erythropoietin component, the bone marrow cannot produce the red blood cell. No. So some clinical signs indicating anemia. So one of the most important signs, especially in detecting, or in all domestic animal, is the mucous membrane. So you will have a pale mucous membrane. No? This is usually a state where there is an O2 carrying capacity, or there is a decreased O2 carrying capacity, which is having a manifestation of pale mucous membrane, decreased exercise tolerance, weakness. The animal is very weak because of this anemic state, and also depression. And when there is anemic state, since the red blood cells cannot or unable to supply all the oxygen in the body, you will see a compensatory like tachycardia and tachypnea, or there is a signs of rapid respiration, and the body is hypersensitive to cold condition. There is shivering, and there is a hemorrhage, and also hemoglobinuria, meaning in your urine, you can see a red coloration in your urine. No? So the hemoglobin is present in the urine. And since there is a problem with tachycardia and tachypnea, there is also a heart murmur, which caused by reduced viscosity. So when there is an anemic, there is a lower red blood cell, and you try to figure out, we have a plasma and red blood cell, no? And there is anemic, reduced number of red blood cells. Meaning, if there is a reduced number of red blood cell, the the blood, the viscosity of blood is reduced. And there is an increased turbulence of blood flow. No, if there is an increased turbulence of blood flow, it could have a heart murmur happening. That's why there is tachycardia and tachypnea. And also shock uh, will will happen if 1/3 of the blood volume is lost in a short period icterus. No? So you should explain it to the owner. The owner will ask you why my dog died. The disease is only anemic. So you can explain it. The dog died because of this shock. Anytime, no? Or anytime will happen with this shock. No? So in anemic patient, the major physical examination finding is pale mucous membrane, and so you can detect it by in the gingival mucous membrane, the conjunctival or ears. So this is usually due to anemic blood in capillaries. So with marked anemia, the blood become less viscous, as what I have said, and may cause a systolic heart murmur. So the classification of anemia. Anemia may be normocytic, macrocytic, or and anemia may be normochromic or hypochromic. Absolute increase in hemoglobin concentration in the RBC does not occur. So just imagine, no? If there is a higher MCHC, a red blood cell cannot carry too much hemoglobin or too much um, oxygen. And then there's only apparent increase in hemoglobin concentration and there is a state of hemolysis. And in non-regenerative anemia or following acute blood loss before erythroid regeneration occurs. Classification of anemia. Normocytic, normochromic anemia, meaning normocytic, normal size of the red blood cells, normochromic, meaning normal color of the red blood cell. So this is due to depression of erythropoiesis. So usually this phenomenon is caused by nephritis or inflammation of the nephron, bone marrow hypoplasia during radiation, and also a disease in ehrlichiosis and chloramphenicol toxicity. It can also be observed during acute hemorrhage after fluid volume has been restored and before regeneration occurs. In macrocytic hypochromic, meaning macrocytic, large size of the red blood cell, hypochromic, lower chromic state of the red blood cell. It is usually observed during recovery from large loss of RBC and is indicative of regeneration. No? Take note of regeneration. So usually it could happen in hemorrhage and or hemolysis. So this usually occurs after hemorrhage or massive destruction of red blood cells, as with the phenomenon or condition in immune-mediated anemia hemoprotozoan infections. If there is a hemoprotozoan infections, the body could detect, or the immune system could detect the problem or the parasite. So they could have a secondary immune-mediated anemia, and also drug toxicity and in congenital anemia of Basenji dogs. So in microcytic hypochromic anemia, microcytic meaning the size of the red blood cell is small and hypochromic state. This occurs during iron deficiency. There is a lack of dietary iron and chronic blood loss to exterior. And also defect in utilization of iron stores. Just a problem in deficiencies in copper, molybdenum poisoning, and vitamin B6 deficiency, or deficiency of vitamin B6. Whereas here in macrocytic, meaning the red blood cell is large, and normochromic anemias, usually the deficiency is B12, folate, and cobalt, or B12, folate, cobalt deficiencies. Unlike in microcytic, there is a deficiency of B6 and iron. It can also observe in erythremic myellosis in cats and poodle macrocytosis. So MCV and MCHC suggests the type of erythrocyte that is being produced by the bone marrow. So these terms, the following terms is very important, no? And also with these following terms, you can see some of the explanation or indication of this, like normocytic. In normocytic, there is erythroid cell maturation is not defective. So that's why there is a normal size of the cell. In macrocytic, there is a young erythrocytes are present, or erythrocyte maturation is defective. No, either of the two instances, there is a young erythrocyte happen or present because of anemia and the body able to compensate, or there is a erythrocyte maturation defective. No, in microcytic, usually there is mitosis during erythropoiesis may create smaller cells. In normochromic, meaning the hemoglobin concentration is normal. So meaning there is the hemoglobin synthesis is complete. In hypochromic, the hemoglobin synthesis is incomplete, or lack of hemoglobin carrying the red blood cell. So it could be young erythrocytes or defective synthesis. In hyperchromic state, erythrocytes were not hyperchromic when produced. So imagine one red blood cell will carry many hemoglobins. No, so it is impossible for the red blood cell to carry more hemoglobin or oxygen. No, so it is either they lost the volume in vivo or in vitro, or there is an erroneous MCHC reading. This table shows the causes of anemia classified by erythrocyte indices, MCB and MCHC. So in normocytic, normochromic, the MCB is WRI, meaning there is within the reference interval. So the MCB is normal, so WRI is normal, no, within the reference interval. So normochromic meaning the MCHC is normal. So usually, if persistent, then typically disorder that reduce erythropoiesis may happen. But most anemias begin as normocytic, normochromic. No? Most instances, anemia will begin in a normal stage or normocytic and normochromic. In macrocytic, there is an increased size and lower hypochromic, and the some indication is the regenerative response after blood loss or hemolysis. In macrocytic normochromic, there is an increased size of MCB and the normal of MCHC. So the some indication is regenerative response after blood loss of hemolysis, occasionally due to defective erythropoiesis, like the happenings in feline leukemia virus induced and podal macrocytosis, and also in vitro changes. So in microcytic hypochromic, meaning microcytic, lower in size and low in hemoglobin concentration, usually there is a iron deficiency and pyridoxine deficiency. In microcytic normochromic, microcytic lower in size and normochromic, normal in hemoglobin concentration. You can also find it in iron deficiency, in liver problem or hepatic failure, or portosystemic shunts in vitro changes. In normocytic hypochromic, you can suspect that there is an error happening. This phenomenon is rarely seen. In normocytic hyperchromic and macrocytic hyperchromic, microcytic hyperchromic, the MCHC or CSCM may be factitiously increased, or a pathologic state may cause true increases of this. I think this would end our discussion for today. So we will talk about more details on anemias in the following week or next week. I hope you find it more fruitful, and I hope that you capture all the things that we discuss and digest it. Thank you, everyone, and keep safe.